Nick, are you going to tell me when you want me to start, or do you want me to just go right at 1 o'clock?
I'll let you know.
You're so good that way. Thank you.
Just after 1 o'clock here, we'll give it just a few more minutes to make sure everybody can join us.
Thanks, Nick.
Any idea how many people you expect?
I don't know. Community Relations did all the publicity for us, but since we were live streaming it and then also going to put it after the fact on cable, we didn't ask for anyone to RSVP to it. So numbers may be a tough thing, only in that people can watch it from their own house or, watch it on Facebook. So
yeah,
hopefully it'll, go beyond just this.
Right.
How are we going to handle the questions, Greg? Chat?
Pardon me?
How are we handling questions? Are they coming in through the chat function or?
Amy, can you answer that?
I think Nick is going to answer that.
Yep.
Oh, that's right. Yeah.
Into the chat or in person.
Oh, okay. So you're going to facilitate that, Nick?
Yeah, I'll take care of it.
Okay, great. Thank you, sir.
And we are recording. We are recording this session too.
Nick, do you have questions in case people are shy? Because I'm sure that will happen.
I'll have plenty of questions.
Make them easy.
You are also good that way.
All righty. We've got a few in attendance and several people watching on Facebook, so we can go ahead and get started.
Hello, everyone. On behalf of the Senior Center, I'd like to welcome you all to this informative presentation on the COVID-19 vaccines. It's my pleasure to introduce the Manager of Community Relations and Marketing from Henry Ford Macomb Hospital, Greg Jacob.
Good afternoon, everybody. Thanks for joining us. Henry Ford Macomb has worked over the years many times with your Senior Center and with your Parks and Rec Department to bring you health and wellness information, and we're happy to be here again today to talk about a very important subject, COVID-19 and the vaccines that are available. There will be some fact sheets and frequently asked questions available afterwards, and I believe they're going to be up on your social media sites. And I'm going to introduce Dr. O'Connell in a second, but I wanted to mention that we're not wearing our masks because I'm at home in my home office. Dr. O'Connell's in his office. If we were out there among the public, we'd certainly still be wearing our masks because that's still an important safety measure that we want everyone to know. So with that, let me introduce our speaker. Christopher O'Connell, B.O., received his Bachelor of Science degree in Biological Sciences from Wayne State University in Detroit in 1995. He graduated from Michigan State University College of Osteopathic Medicine in 1999 and completed his internship and residency at McLaren Macomb Hospital in Mount Clemens. He earned a Master's of Arts degree in Health Professions Education Administration from Michigan State University in 2014 and became a certified physician executive through the American Association of Physician Leadership in 2016. He currently serves as the Chief Quality and Community Service Officer and Division Chief of Ambulatory Medicine at Henry Ford Macomb Hospital in Clinton Township. He's a clinical assistant professor at Michigan State University College of Osteopathic Medicine and member of the Board of Directors for Macomb County Community Mental Health. Please welcome Dr. O'Connell.
Thank you, Greg. Let me get my screen up here. Struggling a bit here, apologize.
I've got the slides open too on my computer, so if you want to.
For some reason, Greg, it's not opening.
Okay. Nick, you want to let me share and I'll open my slides?
Sure.
Yeah, for some reason.
Okay, can everyone see the slides?
I cannot.
Okay, give me a second here. Share screen. It says host disabled participant screen sharing.
Go ahead, you've got authorization now.
Okay. Okay, there we go.
Can you full screen it?
Can you see them?
I can see them. Can you full screen it, please?
Yes.
Just do slideshow. Yep. Okay, there we go. Sorry about that, folks. So thank you. Excuse me. Thank you and good afternoon. I'm happy to spend some time today to talk about the vaccinations for COVID-19. Unfortunately, there's been quite a bit of misinformation and speculation and some outright myths surrounding the vaccines. So my hope today is to provide you with some factual information, clear up any of these misunderstandings, and to refute any myths so that you can make informed decisions about being vaccinated. So in this presentation, I'll cover vaccine safety. I'll talk about how these vaccines actually work in the body. I'll compare the two available vaccines and compare and contrast them. We'll talk about the administration of the vaccines, some possible side effects related to vaccine administration, and then address some frequently asked questions that may be on some of the participants' minds. And at the end, if there's any additional questions or there's clarification that is needed, I'm happy to provide that. So first thing to understand about the vaccines is that vaccines in general are approved only when they're determined to be safe and effective. And there's a vetting process that is done by a number of agencies in order to make sure that vaccines are safe. And these include the Food and Drug Administration, the Advisory Committee on Immunization Practices, or ACIP, and the Center for Disease Control. And at this time, 2 vaccines have received emergency use authorization by the Food and Drug Administration, one being Pfizer and the other being Moderna. In addition to this, experts at our health system, Henry Ford Health System, have also reviewed the data and have confirmed that the Pfizer and Moderna vaccines are safe for administration. Now, the goal of manufacturing the vaccine prior to the emergency use authorization being issued is just to make sure that it's available and we can get started as soon as the authorization has been approved. Next slide. So both of the vaccines that are available are what are called messenger RNA vaccines. Now, the first thing to understand is that these vaccines do not interfere with the host cell or human cell DNA whatsoever. As a matter of fact, they don't even enter the nucleus of the host cell. The vaccine carries genetic information or a code that tells the human or host cells what to look for and identify what's called an antigen. And many of you may have seen pictures of what a virus cell looks like, the ball with the spikes sticking out from it. Now, those spikes are what are flagged as being an antigen. And what happens is the body recognizes those spike cells and produce antibodies that bind to them and prevent the viral particles from binding to receptors in the human cell. Next slide, please. Now, this technology that was used to develop these vaccines has been around for more than 10 years. It's been carefully studied, and there's been quite a bit of innovation and research invested into this particular type of technology. And both COVID-19 messenger RNA vaccines were using existing technology and materials that were used in the development of other vaccines. Both COVID vaccines underwent the same rigorous testing as any other vaccine that's been authorized in the United States by the Food and Drug Administration. Oh, go back one, please. Pfizer and Moderna vaccines were both tested in large clinical trials. And even as we speak, these clinical trials continue on just to monitor the effectiveness of the vaccines. The Advisory Committee on Immunization Practices continues to look at the data, and they were a key organization involved in authorizing the vaccines for distribution. And both the Food and Drug Administration and the Center for Disease Control continue to monitor the safety of the vaccines as we roll out the administration. Next slide, please. So to start, we'll talk about the Pfizer vaccine. And national distribution of this vaccine began on December 13th, 2020. And Henry Ford Health System received its first allocation of vaccines on December 17th. And since then, thousands of our employees have received both their first and second doses. Again, just want to emphasize that this Pfizer vaccine is a messenger RNA vaccine, and it does not contain any COVID-19 virus particles in it whatsoever. They're not, the vaccines are not live vaccines. They do not contain any infectious elements within it, and they carry no risk of causing the COVID-19 infection in persons who receive the vaccine. And as I mentioned earlier, this technology has been around for a long time. And in fact, it's been used to develop other vaccines that are aimed at preventing viral infection with many cancer-causing agents. Next slide, please. The Moderna vaccine began distribution back in December 20th, 2020. And similar to the Pfizer vaccine, it's also a messenger RNA vaccine. They use the exact same technology, and it does not contain any viral particles and is not infectious and cannot cause the infection in a person who receives the vaccine. Henry Ford continues to receive some allocations of the Pfizer vaccine as decided by the state of Michigan. And at some point, we'll begin receiving some of the Moderna vaccine, just probably by the end of this month, so within days. Next slide, please. So just to kind of compare the two available vaccines, I know there's probably some thought as to which one you should receive, but they're very close in their effectiveness and how they're administered. So just to do a side-by-side comparison, studies have shown that the Pfizer vaccine is about 95% effective after both doses are given. For Moderna, that percentage is 94.1%. Both are require 2 separate injections. For Pfizer, it's 30 micrograms doses given 21 days apart. And for Moderna, it's 2 100 microgram doses given 28 days apart. The Pfizer vaccine tends to comes in vials which contain 5 doses, although with a special technique and special syringes, sometimes we're able to get 6 doses out of a vial, whereas the Moderna comes in 10-dose vials. One of the major differences is the storage of these vaccines. For Pfizer, it does require a significantly cold environment to be stored in. So it must be stored at minus 112 to minus 76 degrees Fahrenheit, whereas Moderna is stored at minus 13 to minus 5 degrees Fahrenheit. Pfizer is approved for use in patients age 16 years of age and older, and Moderna is approved in people age 18 and above. Both were involved in significantly large trials, phase 3 trials. For Pfizer, it was 36,621 individuals in that trial. For Moderna, it was 30,350 individuals. Next slide, please. So again, Pfizer vaccine, Henry Ford was selected to receive the Pfizer vaccine by the state of Michigan. One reason is we had the freezers that were capable of storing the vaccine at minus 94 degrees Fahrenheit. The vaccine tends to be shipped in larger quantities, anywhere from 975 to 1,170 doses at a time. Some of the smaller hospitals without the capability of the deep freeze will probably receive the Moderna vaccine, just because it requires, it doesn't require the special freezing process. Next slide, please. Prior to vaccination, anyone who is to receive the vaccination receives an information sheet. And typically, there's an observation period anywhere from 15 to 30 minutes after the vaccine is given, just to make sure that there's no issues. I could tell you I've received both vaccines for Pfizer, and it was about 20 minutes I waited just to make sure that there were no issues. Everything went fine. There's also an opportunity to be educated and to log expected symptoms on an application called BeSafe. This can be uploaded to a smartphone and used to track adverse events or side effects. Next slide, please. So once again, the Pfizer vaccine is administered. It's 2 doses that are spread out by 21 days. The minimum amount of time in between doses is 17 days. If there was a situation in which more than 21 days passed between the 2 vaccines, there's no need to repeat the very first dose. After the first dose, studies have shown that there's a 52% effectiveness with the vaccine. And after the second dose is administered, approximately 2 weeks after the second dose is administered, it's deemed to be 95% effective. And once again, it's approved for individuals who are 16 years of age and older. Next slide. So the question becomes, who should not take the vaccine? Are there people that should be excluded from receiving the vaccine? Well, always, if there's any severe allergy to any of its ingredients. So the next question is, well, what are the ingredients? Well, there's a full list of Pfizer vaccine ingredients available on the FDA website, and I'm sure it's in some of the handouts that will be provided, but you can always go to the FDA.gov website and download or at least look at the ingredient list. And if there's any of those ingredients that individuals had a significant allergy to, may cause pause for getting the vaccine. Or if you had a severe allergy or response to the first dose of COVID vaccine, then you should not receive the second dose. As always, with any vaccines, it should be a discussion between a patient and the physician of the risk versus the benefit. If there are patients who have had reactions to other vaccines, not necessarily a COVID vaccine, then it would warrant a discussion with the provider, primary care provider or physician to discuss the risk benefit of receiving the COVID-19 vaccine. Or any type of reaction to a intravenous or an intramuscular agent may cause a person to pause and speak with their healthcare provider to decide if it's right for them. If a patient has a number of food allergies or allergies to medications or plants or pets, that would not necessarily preclude them from getting the Pfizer vaccine. But again, I would direct you to speak with their provider just to be sure. Next slide, please. So there's special populations that should be considered. So should pregnant women receive the vaccine? As it stands now, there's insufficient data to really make a definitive statement on it. However, pregnant women are at increased risk of actually developing a COVID-19 infection. So a conversation should be had between the patient and the OBGYN provider to see what's the risk versus the benefit of receiving the vaccine. For immunocompromised individuals, there's no live virus again in it, so it won't cause infection, but the concern becomes, will they have a suboptimal response to the vaccine if they receive it? So again, that's a conversation with the provider. And finally, individuals who have an autoimmune disease, it will not trigger a flare of whatever autoimmune immune disease that the patient should have. Next slide, please. So you may have heard by now, since we're starting to vaccinate more and more people, some report side effects. These may occur 1 to 3 days after vaccination, so anywhere from 24 to 72 hours. It seems to be more significant after the second dose and more common in individuals under the age of 55. About 2% feel ill enough after receiving the vaccine to kind of relax and not be involved in their current or their usual activities. So it may sideline about 2% of the individuals who receive the vaccine. Symptoms may last anywhere from a day or two. They can be easily treated with Tylenol or acetaminophen. But individuals should not take Tylenol or acetaminophen before receiving the vaccine because there's a concern that it could potentially blunt the immune response that you want to get from the vaccine. Next slide, please. So what are these side effects? Well, the most common is fatigue, about 63%. Some report headaches, about 55% of the individuals reported headaches. Muscle aches, 38%. And with regards to that, many will just feel a soreness in the area where the injection site was. So maybe your arm feels a little tender for a day or so. Joint pain was reported in about 23% of individuals. And then some have reported a fever, about 14.2%. Basically, guidelines would be if you do have a fever, you should stay home. If symptoms last more than 48 hours, it's a good idea to contact your physician just to go over the symptoms. And of course, if there's any symptoms that suggest a COVID infection, such as cough, shortness of breath, runny nose, sore throat, loss of taste and smell, definitely stay home and contact your provider for further instructions. Next slide, please. So in the news, there's talk of variants of the COVID virus, in particular, the United Kingdom, South Africa, and Brazil. The thing about viruses is in order to survive, they need to constantly change or mutate so that they can continue to be viable. There's no evidence that the new variants cause more death or severe illness. However, they have been found to spread more quickly and easily. Early studies have shown that the Pfizer and Moderna vaccines appear to have some effect against these variants. Of course, scientists continue to study to learn more, and I anticipate there'll be more discussion of this as time goes on. Next slide, please. So the timing of the vaccine, again, 14 days in between the two doses for the Pfizer vaccine. Individuals should wait a minimum of 2 weeks or 14 days after any other vaccine. So if you're getting a different type of vaccine, which would include the flu shot, there should be a 2-week period in between receiving that shot and the COVID-19 vaccination. There is one exception, however. Tetanus shots should not be delayed. So if a patient is injured or gets a wound that requires an update of a tetanus shot, that should be given regardless of when the COVID-19 vaccine was given. The other consideration is patients who have actually been infected with COVID who've received convalescent plasma or the monoclonal antibody treatment that's been in the news. Those individuals need to wait at least 90 days before receiving the vaccine. Next slide, please. So now I'd like to talk about a few frequently asked questions that may be on the minds of anyone who's listening to the presentation. So it's always a concern, are there preservatives, eggs, or latex involved in the manufacturing of these vaccines? And the answer is no. There's no eggs used, there's no latex or latex derivatives in the vaccine, and there are no preservatives. So some ask, if I have an underlying health condition, can I still get the vaccine? And the answer is yes. In fact, you're at increased risk for developing illness from COVID if you have an underlying health condition. So it's always a good idea to get vaccinated against it if you can. So do I still need to wear a mask and social distance even after I've received the 2 doses? So you receive 2 doses, you wait the 14 days. Should you still wear a mask and should you still social distance? Yes, absolutely. There's not enough information on how the virus spreads and how long the vaccine will be effective for. So for the time being, until more data is obtained, until the studies are more conclusive, should continue to follow the practices of social distancing, wearing a mask, washing hands frequently, and avoiding large crowds. Next slide, please. Can a person who has had COVID-19 still receive the vaccine? Yes, absolutely. Again, normally there's a waiting period, but you can still receive it. It will still be effective and useful to you. How long does it take to get full protection? Usually about 2 weeks after receiving the second dose is when you can expect that you are at the maximum level of effectiveness for both the Pfizer and the Moderna vaccines. And again, how long is protection against the virus? How long does it last? Unfortunately, that remains to be seen. Clinical trials, as I mentioned, continue on, and we're looking for additional information to really answer that question definitively. So the short answer is it's unknown, but trials and investigations continue to find out how long we are protected for once we receive both doses. Next slide, please. Does the vaccine affect fertility? At this time, there's no evidence that the vaccine affects fertility. As I mentioned, it's a concern in women who become pregnant. Research studies still show that, the vaccine does not affect fertility. But again, trials continue. If I'm breastfeeding, can I get the vaccine? Yes, but as mentioned earlier, I would always have a conversation with both your doctor and your child's pediatrician if there are any concerns that you have. How many vaccines will Henry Ford deliver? As many. The short answer is as many as we're allocated, but and Henry Ford anticipates that they will deliver more than 1 million doses of vaccine. Next slide, please. So the big issue is vaccine supply is limited. I know that there are probably individuals who are ready and willing to be vaccinated and are just waiting to find out where and when. The truth of the matter is the vaccine supply is limited. The allocation by the government and the state, is parceled out. So it's not a matter of us being willing to do it. It's not a matter of us being capable of doing it. The rate limiting step, frankly, is the number of vaccines available. So as more vaccines become available, vaccination efforts will ramp up and will become more widely available for more people. Next slide, please. So Henry Ford Health System is being proactive with it, and they will reach out to patients who are, when it's time for them or when it's possible for them to schedule an appointment and receive a vaccine. Henry Ford will use email, text, phone calls, depending on whatever type of information you've provided as to how you prefer to be contacted. And there'll be instructions as when and how you can make an appointment when you're contacted. Next slide, please. Unfortunately, at this time, vaccinations in this area are by appointment only. Henry Ford does not have walk-in facilities for vaccinations at this time. And again, Henry Ford's reaching out to patients once they become eligible and vaccines are available to help patients schedule both the first and second doses of the vaccine. So there's really no need to check my chart for open vaccination appointments because that capability is just not available at this time. And the vaccine is not available at physicians' offices, the emergency department, or the urgent cares. And calling the contact center, it's not possible to schedule appointments through this means as well at this time. More appointments will be available again once the allocation of vaccines increases. Next slide, please. So we're ready to go. As I mentioned, we have a number of sites ready to accommodate large numbers of patient safety. We're just waiting for more vaccines to come in so that we can do that. So when a patient's contacted to make an appointment, information about where and when to go will be given to them. And there may be, based on the number of people and how many vaccines, locations could potentially change as the vaccine allocation increases. And the whole idea is to really vaccinate as many people as possible and to make it as convenient as possible. So there'll probably be more to come with regards to that once we have the vaccines in hand and are able to distribute them. So what can you do now? Well, if you are a patient, you can sign up for my chart. There's a streamlined process for it. You can visit henryford.com, visitors, my chart. The thing is you'll need a medical record number. So if you've been an established patient, you have a medical record number already. And that number is used to activate a MyChart account. Just keep an eye out on your email, text, and your voice mail and wait for a call or a text or an email. But again, it's important to continue using social distancing techniques, wearing a mask, washing your hands frequently, and trying to avoid gatherings of large crowds. And I know it's easy to say to be patient. Everyone's anxious to really move on with life and see some light at the end of the tunnel. But again, once we get the allocation of vaccines and we're able to really start some mass vaccination processes, we'll be ready to go. Next slide. So again, if you have symptoms of COVID, you should still get tested. So if you're exposed or you start to have the symptoms, which I'm sure many are familiar with at this point, if you're a Henry Ford patient, you can always call the MyCare advice line to see if testing is something that you should do and where you can get that done. Henry Ford has several walk-in site testing sites. If you live in the area, specifically in Detroit, Dearborn or Park, or there are some sites in the local area as well. But again, you could call that advice line and they could best direct you on where to go. Next slide. Of course, for more information, it's available on our website, www.henryford.com. It's got the most recent updates, and as anything new comes out, the website's updated. Of course, you can always visit the Center for Disease Control and Prevention website. And if you have specific questions related to your healthcare, as mentioned throughout this presentation, you should contact your physician and talk about your health and the vaccine. Next slide. Okay, so that's the end of the formal presentation. Again, I appreciate the opportunity to talk with you on it. The only thing I will mention too is, when we're in a situation like this, there's always a chance for people to take advantage of it. And there's been some news articles talking about individuals who are reaching out to patients or individuals saying that if they pay a certain amount of money, they can get a vaccine, or if you give this certain information, we will get you first in line for a vaccine. And you got to be very careful with that. Many times these are scams. I can tell you that the vaccine is paid for by the government. So if people are asking you to pay money to get the vaccine, you need to take pause and really question the legitimacy of that. Also, you should not be giving out your personal financial information, social security number, things like that, to individuals who promise to be moved up in the line. That just isn't possible right now. So if people are offering that, you can be assured that it's probably not legitimate, and that should be something you should really consider. With that, I'll complete my comments, and I'm happy to answer any questions that anyone has.
Okay, thank you, Dr. O'Connell. For those of you that are joining us virtually here on Zoom, there's two ways that you can ask questions. The first one is going to be pressing the raise hand button that's at the bottom of your screen, or you'll see the same thing on a cell phone if you're using that. Or you can type the question to us using a Q&A session. You'll see Q&A at the bottom of your screen. You can just type out your question. We do have one question already. It reads, currently, I am hearing too many incidences that some younger residents, in most cases younger than 30, are receiving vaccinations. Why are these individuals not in the governor's qualified group allowed to receive a vaccine?
That's an interesting question. I'm not sure. I can tell you from a Henry Ford standpoint, we follow the guidelines of the state and the government. Where these individuals are getting this, I don't know. If they're essential workers who are exposed or actively working with patients who are COVID positive, many of our house staff or residents and students who are working directly with COVID patients, we've vaccinated them, but it's only because they're directly caring for these patients. But if these individuals who you've heard of are not essential workers or not healthcare workers, I'm not sure how they receive it at this time, because it certainly isn't in line with the rollout of who should receive them.
Hello, can I ask?
Sure.
Nick? Oh, hey, guys. Hi, Greg. Hi, Chris. Yeah, I'm Rick Stathakis from Shelby Township. I'm the one that asked that question.
Okay.
I'm getting an earful from residents, as I would be upset too. I'm just passing on their question. In fact, I just talked to two of them this morning. One's 72 years old, one's 74, was unsuccessful, and again, in getting a vaccine. They know of situations, and by the way, so do I. Somebody actually admitted on a Zoom in a meeting that bragging about the fact that, I'm only 35 or whatever, and I got a vaccine. So it's a known situation. But my question is this: why isn't it monitored in such a way, whereas if you're not 65 or older, if you're not a government employee, if you're not a teacher, if you're not a nurse, if you're not a police officer or fire, whatever, that you cannot get a vaccine? I mean, wouldn't it be as easy as you pulling out a license or someone walking in looking like they're not 65? I mean, why is this not better administered? There are a lot of people out there that are not happy.
I certainly understand that. All I could say is, I could say what we do here. And of course, if they weren't in the essential groups or in the phased groups, they would not receive it from us. I would probably want to know what the circumstances were, how this person got it. If they're not a healthcare provider who's caring directly for someone, and that it'd be speculative for me to say how they received it, because I just wouldn't know.
Yeah, I would echo what Dr. O'Connell said. I know our process is by invitation and by medical records only. So, when you're notified by Henry Ford Health System that you're in line and it's time for you to get your shot, you're notified to come in, and you're ID'd at that point. So, there is a checkpoint. Again, I would ask the same question that the doc did. I don't know where these people are getting their shots and why it's happening. So I'm sorry, I don't have a better answer than that.
Mr. Stathakis, do you have any other questions for the doctor?
I just want to add one thing. Greg, it's not happening at Henry Ford. And Chris, I know you can't fix this. I just wanted to vent that so that both of you would know. And
Yeah, thank
you're
you.
both doing great work, and I want to thank you for what you're doing.
Well, thanks a lot. We appreciate it. And as much as we can, we'll look into that information to see if I can find out an answer for you, where and why that's happening in terms of the shots getting to, people who are not qualified at this point. I know another message we want to get out to everyone is all the health systems and the health department are in the same boat right now, in that we would be doing a lot more vaccinations if we had the vaccine. As soon as we get that, we will open up the doors again. But we want to make it clear to people that even if you're not a Henry Ford employee, or not a Henry Ford patient, and a lot of people are, we have great health systems in Macomb County. Get the shot wherever you can from one of the other health systems. If they get their supply before we do, or if the health department opens up before we do, it's important that everybody get vaccinated. Not so much where you get vaccinated, but just get that vaccination. So we want to emphasize that. Get it wherever you can and when you can, when it is available.
Chris, I've got some questions to pass along here, and I do understand that the scope here is Henry Ford Health Systems, but maybe we can talk a little bit broader.
Sure.
There are so many opportunities, or I should say locations, for vaccinations between your hospital, Beaumont, pharmacies, county health systems. What's the best guidance to give to especially the senior population, where they're frustrated they can't get any right now?
Yeah, I mean, it's an issue. I have members of my own family are struggling to get it, and when they call me to ask what to do, I don't have the best answer other than wherever you can get it done. I mean, I know that there's been people who have putting themselves on lists for some of the pharmacies in the area, health department. So I guess my best advice would be get on every single list, and the first one that calls you is where you go to get it done. I wish I had a great answer. And as you heard the theme through the entire presentation, what Greg just underscored, the rate limiting step is getting the vaccines. If we could get the allocation that we need to really vaccinate, our community, we would do it. We have the means to do it. We have the will to do it. It's just we're lacking the most important ingredient, and that's the actual vaccine.
Do you anticipate this becoming an annual vaccination like the flu shot is now?
It seems to be the case, and in the scientific community, I think that this is a virus that's probably going to be around and something that we have to deal with. Similar to the flu every year. And as I mentioned in my presentation, the issue is that viruses, in order to stay viable, have to continue to change. So we might see a variant of it that comes up, in a different time of the year or something like that. We're just going to have to be vigilant, and there may be a situation where we're getting vaccinated annually for it. I think as we learn more about it, I know it seems like it's been going on forever, but it's been a year. And we're still learning each and every day more and more about it. So once we gather more information, we'll be able to really get some better, more accurate predictive models of where this virus is going and what we can expect in the future. But the short answer to your question is, it's likely that it will be something that we have to deal with on an ongoing basis. The hope is that we can get it to a point where it's less virulent and less contagious. And it will become something similar to what we experienced with flu.
So we've heard Dr. Janae Caldoun say that she anticipates end of fall, early winter, we might reach herd immunity. Given the vaccination rollout has been so slow and not the way it should have gone, do you think that's still a feasible target?
It's going to depend on how quickly they can get us the vaccines. In order to achieve that herd immunity, you have to have a certain percentage of people who actually been vaccinated. But as you mentioned, things have been going very slow with regards to that. So if we can't achieve that magic number of vaccinated individuals, it may be pushed a little bit further.
My last question for you is, I know the goal of this presentation is to convince those who are not convinced to get the vaccination. If they're still on the fence, even after your presentation, what's your advice to them?
I would have a conversation with your provider. Again, it's a risk-benefit type of a decision. My goal today was to just give you the facts, because as I mentioned right at the very beginning, there's a lot of fallacies surrounding it. There's a lot of speculation and an outright myth. So I just wanted to give you the facts. You take that information and use it to make the best decision for you. But even better is to sit down with your healthcare provider and talk about what the risks are if you don't get it versus if you do get it and receive protection, how it can help you.
We appear to have one lovely senior in our senior center right now, and their virtual hand has been raised. Amy, if you'd like to unmute yourself, she can ask that question if she'd like.
Yep, it's actually me, and I'm just asking on behalf of a lot of seniors because we've heard, as you have all heard, the difficulties in obtaining the vaccine. And the wide question that we're getting is, do you anticipate this lack of access to vaccines to continue for the foreseeable future? Do you think that we will have more widespread access within the next few weeks? Do we think it might be in the next few months? What do you think? They want it very soon, as you know, and I know you're hearing that as well. But they're just wondering, is there a time when you feel like, you're going to have an easier time to get that? And is it that might be something that you're hearing on your side down your pipeline? But we're just curious as to if that might be a possibility. And lastly, just a thank you for the wonderful information. I know a lot of people will benefit from it. So thank you both.
Right. It's one of those things where it's a demand issue. And, as we all know, this is all across the world that there's demand for these vaccines. I read an article regarding production and, basically the theme of the article was, why can't we keep up with the demand? And there's quite a significant process involved in developing these vaccines. And there's these steps need to be taken very carefully. They can't be rushed. So there's some time limiting steps involved in actually production of this. So to say just double your efforts, it just doesn't work that way. I anticipate that we'll eventually catch up to a point where we'll be able to get our allocation appropriately so we can really start ramping up the efforts. I think it would be, I hesitate to say weeks, maybe a month or so, a couple months maybe, but I'm not convinced that weeks is something that would be achievable. Again, it's almost a day-by-day thing. We get information from the state as to what's available to us, and we're happy to get whatever we can, but our response to the state is we need more. As it stands, we've only gotten a percentage of what we've requested, a very small percentage. So, although we'd like to do more, we're doing the best we can. So hopefully, if the production catches up, we'll be at a point where we're able to really open things up and really just start mass vaccinating our community.
And in the meantime, we have to continue doing the very simple safety measures. As I can see, our friend down there is who asked the question. She's wearing her mask. So we're encouraging people to continue wearing those masks, washing your hands, and staying socially distanced. Unfortunately, those are the simple things, the safest things we can do, and they're very simple, and we have to keep doing them, even though we're very tired of doing them. But until the vaccine supply is back up to a more robust level, it's those simple things we are emphasizing people to keep doing.
Dr. O'Connell, Greg, thank you so much for your time. Thank you to Henry Ford Health Systems for providing the information. Hopefully we can get some more people convinced that a vaccination is a good thing, and hopefully we never have to have this conversation again.
Absolutely.
Agree. Thanks for having us.
Thank you for your time.
Have a great day, everybody.
Thank you.